Slides are visible.
Yes, Deepti.
Okay, good evening everyone. Uh, Today, materia class will start with eye. Okay, then we'll go to female genitalia. Colored light produces dizziness. Medicine is Artemisia vulgaris. Acha, for what cases do we generally use this medicine? Artemisia?
Epilepsy without aura.
Epilepsy without aura. Very good. That is petit mal epilepsy, right? Epilepsy without aura is petit mal epilepsy. Petit mal epilepsy without aura. Acha, can you name any other medicine for petit mal? Viscum album. Okay. Another medicine for petit mal. Artemisia vulgaris, another very important, what to say, symptom which you can be asked is that it has a peculiar feature. Artemisia has sweat, profuse sweat, which smells like garlic. Smells like garlic. Central scotoma for red and green light, not for white light. It is carbonium sulfate. Acha. Now, taking these points, red light and green light. Okay. One medicine has got change in acuteness of perception of shades of green. Perception of shades of green. Change in acuteness of perception of shades of green. It is heart remedy.
Phosphorus.
No. Phosphorus is similar, but not this. It is digitalis. How will you differentiate? I'll tell you. Phosphorus has symptom, letters appear red. Letters appear red and there is a green halo about the candle light. Green, hello, about candle light. Okay. Everything looks white. Chloralum hydratum. Everything looks white. Cyclamen, there is a point, sees countless stars. Acha, write this. Acha. Now see the symptom. Corrects blurring and discomfort in the eyes even after acutely adjusted glasses. Gelsemium. Okay. We have another medicine. Okay, this is from Allen. Pay attention. Which has got schoolgirl's headache, schoolgirl's headache, which is aggravated during study or mental exertion, anything. And here also glasses fail to ameliorate. Glasses fail to ameliorate. What is the name of the medicine? Okay, another hint, very important hint. With a tubercular history. Now I have told you, given the hint of the name itself. With a tubercular history. You need hint now also after this tubercular word. What is it? Apurva. Already. Tuberculinum. Tuberculinum. Okay. What are the other medicines which has got this schoolgirl's headache? One is tuberculinum. Okay, where glasses fail to ameliorate, which is aggravated from study when using eyes in close work, mental exertion. Other medicines for schoolgirl's headache. Acha, this extra, when you study schoolgirl's headache anywhere, try to jot it down altogether. Because nowadays it has become a fashion that they give this bracketed drugs also. All except question they will give. Hello? Okay, okay, wait. Screen is visible. Screen is visible now. Please see, screen is visible now.
Yes, Devi.
Okay. Acha, till where was I not visible? What was the last thing that you could hear?
इंक्रीज काउंटलेस स्टार साइक्लामिन, उसके बाद ये ट्यूबरकुलिनम वगैरह ये सब नहीं हुआ था।
ये सब नहीं हुआ। ओके। ओहो, नो प्रॉब्लम। I was telling that corrects blurring and discomfort in the eyes even after acutely adjusted glasses. This is gelsemium. Okay. Now, when I talk about glasses, another symptom that comes to my mind is that schoolgirl's headache, which is aggravated from study, from mental exertion, when glasses fail to ameliorate. When glasses fail to ameliorate, see this line, when glasses fail to ameliorate. If it is associated with a tubercular history, then the medicine is tuberculinum. Okay. Now, schoolgirl's headache. This is a very important MCQ question. Mainly, what do they ask? They will ask all except question. Now, what I was telling that nowadays it has become a trend of these AIPGT papers that they will give 3-4 medicines and you have to pick. You have to pay attention to the bracketed drugs also. You have to pick which one do not have that particular symptom. Okay. What are the medicines that has this schoolgirl's headache?
कैलकेरिया फॉस, नेट्रम्यूर,
Okay.
मैकफॉस,
Okay. Calcaria phos, natramure. Another one,
मैकफॉस,
macphos. Is it there? Sorinum. Sorinum. Okay. Sorinum. I have seen this one in all except question. It has come in some year question. It was there. Okay.
है दीदी, मैकफॉस भी है।
हाँ, macphos भी है. So put it in one place. Number it like 1, 2, 3, 4, 5. When you are preparing materia notes, try to study it this way. It will be easier for you to remember, easier for you to sort out. Okay. अच्छा. अच्छा, now suppose one person is seeing objects which are like I am seeing it as a normal object, but it appears to him in very large in size. What will be the medicine? Like objects appear too large. Objects appear too large. What is the medicine? Everything seems bigger. The patient is having megalomania. Everything appears to him. Sorry. Objects seem small. Sorry. Like all the objects will seem small to him and everything appears too small. Megalomania. It goes with the patient's personality also. He thinks or she thinks, it is better to say
प्लेटिना,
she, huh?
प्लेटिना,
Platina. Proud patient, platina. So, just as everyone around her appears to be smaller to her, objects also, eye symptom also, it is same. Objects appear too small. Megalomania. The patient is having megalomania. Okay. The exact opposite thing, objects appear too large. Small objects look large.
Euphorbinum.
No,
Euphorbinum.
it is stramonium. Stramonium. Okay.
दीदी यूफोर्बियम में भी तो एवरीथिंग अपीयर्स लार्जर देन इट इज.
Euphorbinum.
फॉर्बियम. हाँ.
Yes, everything appears larger. Everything appears larger. Euphorbinum. Write this again, we will discuss after that. Orbital neuralgia, better by pressure and rest. Asafoetida. Okay. Diplopia, triplopia. Both are present in belladonna. Okay. Now, from diplopia, I am going to hemiopia. Sees only lower half. What is the medicine?
ऑरम में.
Or a bit. Okay.
ऑरम में.
Okay. Very good. Acha. When in hemiopia, the patient sees only the left half.
लिथियम का ग्लाइकोपोडियम.
Lithium carb and lycopodium. Diplopia. A very important line from Allen. Diplopia, where one image is seen below the other. Follow. One image seen below the other. I think this is the only drug in Allen which has got the term diplopia written in it. What does come to your mind? Anyone?
सिफिलिनम.
Syphilinum.
सेलेनियम. सेलेनियम.
No, syphilinum. As far as I remember, this is the only drug that is having diplopia written in Allen. Bleeding from hemorrhage into the retina. Bothrops. Okay, bothrops. Another one is that you will have day blindness also. Day blindness missed before the eyes. Another important drug is ranunculus bulbosus. Okay. So retinal hemorrhage, one we have bothrops. Hemorrhage into anterior chamber after iridectomy.
फ्रीडम पाल.
Very good. Lidampal. Night blindness. See, there are many medicines. Nux vomica, physostigma, cadmium sulf and helleborus. Acha. Medicine for nystagmus. Among these four, nystagmus, physostigma.
Physostigma.
Okay, physostigma has got nystagmus. Yellow vision. One is santorinum. Another one is cantharis. Okay, has anyone ever prescribed cadmium sulf? Yes or no? Ever prescribed? Not prescribed. Cadmium sulf is a very important drug for stomach cancer. Okay, very important drug for stomach cancer. But you will find the word stomach cancer written as carcinoma ventriculi. That means stomach cancer. Carcinoma ventriculi, with there will be persistent vomiting and coffee ground vomiting, hematemesis. It is a very good medicine. Coffee ground vomiting. Okay. Now, uh, suppose a patient comes to you and he or she says that I cannot look properly, but when I guard my eyes with my hands, I can see better. What is the
Phosphorus.
medicine? Huh?
Phosphorus.
Very good. Patient sees better by shading eyes with hand. It is phosphorus. Achha. We have saw that which medicines are having uh, small objects appear too small, as big objects appear small, small objects appear large. But if you have sense of enlargement of the right eye, which feels larger than the left, what is the medicine? Sensation of enlargement of right eye,
Como. Comocladia.
comocladia, which feels larger than left. Comocladia, very good. Write this, then again we'll go. Achha. Ciliary neuralgia after surgery, especially after removal of eyeball. Medicine is meserium. Now we'll discuss two more medicines which are having ciliary neuralgia. Okay, listen carefully. One is having ciliary neuralgia, which you get going, which is aggravated on going upstairs, and ameliorated from lying down. Ciliary neuralgia aggravated from going upstairs, ameliorated from lying down. What is the medicine? Okay, hint. Line from Allen. Easy drug. Generally a female drug. Not audible, not audible. Not audible. Okay. The drug is Simsifuga. Okay. Another one. It is not actually neuralgia. Spasm of ciliary muscle with irritability after using ice. Yes, tell me. Anyone? Answer is physostigma. Okay. Now physostigma has another important symptom, that is pain in right popliteal space. Pain in right popliteal space. Another line from Allen, which is very commonly asked of physostigma, is the first line that you get. Uncommon mental activity, cannot stop thinking. Can't stop thinking. Okay. Now physostigma has got tetanus among its symptoms, which has got a very peculiar modality. What is that?
बराबर से कोई क्रॉस करता है तो उसकी हवा लगने से ही उसको
Very
जो
good.
स्पैज़म हो जाती
Very
है.
good. Which is aggravated by slightest breath of air of a person passing. Air of a person passing. Now this is this symptom is also present in a number of other medicines. One is physostigma, which we have. Acha. Now remember Nux vomica. It is a drug used for convulsions. Okay. And it is also very affected by these external impressions. Easy to remember. Nux vomica and strychnine. Both are of same type of medicine. Both has convulsions in its what to say within its symptoms. Hypericum, another very important drug for tetanus, and lysine. Remember these four medicines, okay? This has got the same symptom. Promotes absorption of fragment of lens after operation. This line is very, very important. Very important MCQ point, comes frequently. Promotes absorption of fragment of lens after operation. It is Seneca. Okay. Now pay attention to this line. Reading difficult as type seems to move. Swim. Medicine is agaricus. Okay. Now we have a medicine where the eyes seem to swim. What is that medicine? Eyes seem to swim. No idea? It is squilla. Quite uncommon for eyes. Eyes seem to swim is squilla. Okay. Now with swimming, this swim sort of MCQs come. One is when the letters seem to swim, it is agaricus. Eyes seem to swim, squilla. Rest two are easy. One is stomach feels as if swimming in water. This you know. Stomach feels seems to swim. Abrotenum. And heart seems to swim. This one, heart seems to swim. This one is Bufurana. Okay, these are very frequently asked, and this is like very confusing. Okay, better to make it up like point wise. Gnawing, itching in all parts, especially eyes, Agnus castus. No. Useful in restoring power to weakened ciliary muscle. It is Lilium tig. Okay, write these points. These last four, write it together. Okay. Iritis with hypopyon. It is present in marked sol. Iris, which is muddy in color, thick, neither contracts nor dilates. Mark cord. Okay. Acha. These all are very important. They come. One which objects appear too far away. It is anacardium. Objects first recede, approach, and seem double. It is cicuta. Seem to approach and then recede. Cicuta. Objects seem to approach and then recede. Okay, now the opposite. The objects fade away and then recede. Sorry, and then reappears. What is the medicine?
Gelsimia.
Gelsin. Objects appear grey and upside down, guaria. And objects appear red and too large. It is Hepar sulf. Okay. There is a single medicine for astigmatism. What is that? You have, I think, read in your single medicine in repertory.
Tuberculinum.
Tuberculinum. Very good. This we have already discussed. Acute dacrocystitis, iodine. This line is very important. Sees everything half light and half dark. It is glonowin. Retinal images retained long after using the eyes. Javelin. Achha. Weak sight from excessive sexual indulgence. Very important. This you know. Calicard. Scleritis, where pain is increased by moving the eyes. Medicine is calmia. Okay. Achha. Now, suppose there is inflammation of eyes with discharge of thick yellow matter. What is the medicine? Discharge of thick yellow matter from the eyes. What is the medicine? Yes? It is calcarea sulf. Calc sulf. Okay. Cataract with gout is Lidampal. Now tell me, a patient has photophobia with inflammation of eyes and he cannot keep his eyes open, so he buries his face in a pillow. What is the medicine? What is the medicine?
Rhinum.
Why not conium?
Without inflammation, you know.
Very good. Because conium does not have inflammation. Conium, there is photophobia of students from using artificial light. All these things are there. But whenever you see that inflammation is present, just strike off conium. Conium has photophobia without inflammation. Without inflammation. Okay. Slightest ulceration or abrasion will cause the intense photophobia. What is the medicine? Very important line from Boric. Will cause intense photophobia. What is the medicine? Bolo. Gopal, bolo. It is conium. Remember that conium, photophobia, inflammation is not present. But photophobia can be caused by ulceration or abrasion, but inflammation will not be present. Okay.
क्या दीदी एक बार और बता दीजिए, ये पॉइंट समझ नहीं आया.
Conium is having photophobia without inflammation. Okay. But conium will also have photophobia from slightest ulceration or abrasion. Inflammation is not present. If you see photophobia with inflammation, strike out conium. But this line is extremely important. Slightest ulceration or abrasion will cause intense photophobia. That is also conium. Okay. Achha. Chronic ophthalmia that constantly recurs. Bolo. Chronic ophthalmia constantly recurs. It is Suranjana. Okay. Then we'll go to female genital symptoms. Write this. We can discuss after that. Ailments following abortion, Sabina. Abortion at 3rd month. All except question may come. Actia resmosa, Sabina and sepia. Passive hemorrhage after abortion is scolophyllum. And tendency to miscarriage at 3rd month, Sabina and sickle cord. Achha. Now, let us see some pregnancy related symptoms. During pregnancy, inability to walk. Uterus feels sore as if squeezed. What is the medicine? What is the medicine? Okay, it is a very well-known medicine for injury and gardener's remedy. I think something railway spine or something is there. Now tell me, what is the medicine?
Bellisper. Bellisper.
Mm-hmm.
Bellisper.
Bellisper. Very good. Achha. right? These things are also some related to abortion. One is threatened abortion, flow ceases and then returns with increased force. Pulsatilla. Another, this is threatened abortion. Another symptom is there where you will have threatened miscarriage from mental depression, night watching, shock. What is the medicine? Threatened miscarriage from mental depression, shock, night watching, low fevers. What is the medicine? Okay, hint. It is a very good medicine for typhoid and it has got muscular soreness and offensiveness along with it.
Baptisia.
Baptisia. Very good. You cannot even think that, okay, it is having threatened abortion or threatened miscarriage, but this is a very, very important symptom. Frequently asked. Okay. Habitual abortion from uterine debility. Colophylum, Alatris, far. Okay. When I'm speaking of uterine debility, let me take one more symptom. Uterine inertia during labor. Uterine inertia during labor. Okay, hint is that it is a very good medicine for paralysis. Patient is constipated, cannot pass stool unless he is standing. Very chilly patient. Paralysis of single part even occur when the patient has been exposed to
Causticum.
cold air.
Causticum.
Yes?
Causticum.
Causticum. Causticum is also having uterine inertia during labor. Habitual abortion from anemia with profound melancholy. It is Helonius with profound melancholy. Helonius is chiefly a drug which is given for bad effects of abortions and miscarriages. See, bad effects of abortions and miscarriages. Along with that, a characteristic sensation of Helonius is there is a distinct consciousness of a womb. Consciousness of a womb. Okay, which moves when she moves. Helonius patient is generally very depressed, very sad patient. There is much depression. It is like you can correlate. You don't have to remember everything. Like you don't have to memorize everything. A female patient is having repeated abortion. There is what to say? If a patient is having abortions, miscarriages, a mental depression, a melancholy mood will be associated. Isn't it normal? Here the patient is having Too profuse, too early menses from uterine atony. Okay. Very heavy flow where the patient loses more blood than it is made. Uterine atony. From uterine atony, the patient is having early and profuse menses. Early and profuse menses. Helonius also has albuminuria. Acute or chronic during pregnancy. Acute or chronic during pregnancy. Okay. Labor. After pain, hourglass contraction.
Cyclic cord.
Sickle cord. Very good. After pain, worse in groins. After pain, worse in groins. Actia resmosa.
नस में का
Huh?
अच्छा
Actia resmosa. Another symptom is there where you will have after pain which is very spasmodic but across lower abdomen. Primarily the pain is in lower abdomen. Across lower abdomen which extend into the groins. Can you tell me? Which extend into the groins. What is it? It is colophylum. Okay. Colophylum. Achha. When the after pains are felt in shins, in the shins, medicine is carbovage and cocculus. Carbovage and cocculus. Okay. Achha. During labor, everything seems loose and open, but there is no expulsive action. Sickle cord.
कार्बोवेज और कॉक्यूलस बोला दीदी आपने क्या
Cocculus, हाँ. Okay. Acha, sickle cord you can give for gangrene. How will you differentiate the gangrene of sickle cord with the gangrene of ourself? Subjective symptoms, no objective. बोलो.
बर्निंग से
हम्म.
बर्निंग
Burning is present in sickle cord, isn't it? By seeing the modalities. I saw a patient of gangrene. I think it was in my first year of this MD life. The patient was diabetic. When I saw his reports, it crossed like 650 or 700 mg per deciliter. The sugar level crossed 650 or like that. The patient already had one finger amputated of his leg. Okay, he was exactly a sickle cord patient, a very old patient. Dryness was there and it was dry gangrene. Okay, and by seeing the patient, I took the modalities. Like in one of his feet, I don't remember whether it's left foot or right foot. I don't remember. His last finger was not there; it was already amputated. So the fourth finger, uh, that one had that finger, in that finger gangrene began. So I just gave him sickle cord 0 by 1 and 0 by 2. I forgot to take the click the picture of that initial state. He came after 1 month, and like I could not believe myself that only within 1 month sickle cord 0 by 1 and 0 by 2 has done wonders. So no trace of gangrene was there, completely healthy skin, and it was like that miraculous recovery had taken place. Okay, you have to see the modalities for sickle cord and arsenic. Sickle cord, it is it aggravates from external heat, whereas in arsenic it is the exact opposite. It is ameliorated from heat. This is the differentiating point. Okay. Acha. Fetus decomposed, dead for days, black, horribly offensive discharge. Medicine is pyrogen. Acha. Fetus decomposed, dead for days, one medicine is pyrogen. Okay. Another one which can expel moles, dead fetus membranes. What is the name of the medicine?
Sabina.
Sabina, dead fetus is mentioned over there. Sabina is a good medicine for expulsion of moles. Okay, very good. But dead fetus, see the line. Tell me now. It is cantheris. Okay. Cantheris, another important symptom is there. These urinary symptoms are very important in cantheris. So, when you see the point, puerperal metritis with cystitis. Puerperal metritis with cystitis. Take this cystitis as a point, and the answer is cantheris. Okay, last line. Achha, this you know, this is a common symptom, this you all know. Labor pains causing violent spasmodic urge to stool or to urinate, aggravating back, nuts vomica. Okay, tell me this. Metrorrhagia from retained placenta and delirium symptoms. When stramonium fails, what is the medicine?
Sickle cord.
Very good. Sickle cord. Chalo. Puerperal convulsions continue after delivery. It is Sikuda. Acha. If the question was puerperal convulsions immediate after delivery, what would be the answer? Bolo. This is given for menopausal women. Where the woman is having intense flushings. Acha, one hint, you have not read this in your BHMS syllabus.
Actia racemosa.
No, actin asmosa was there in your syllabus.
नहीं.
Nahi. You haven't read. Okay. If you haven't read, please go through it. Atheresmosa, I myself have used successfully not only for menstrual cases when the patient is suffering from cervical spondylosis pain. Maximum patient you will see that you will ask that do you are you like involved in stitching or sewing. If the patient says yes, that I have to, even if you're like seeing something or reading something, neck is like in a wrong position for a long time, whenever the bellies of the muscles are affected, Actia resmosa is a very good medicine. You can
amyl
give
nitrosum.
Simsifuga mother. Acha, this one is not Actia resmosa, this is amyl nitrosum. Very, very important, amyl nitrosum. Amyl nitrosum has got a very interesting symptom which we generally encounter when we sit to study. That is profound and repeated yawning. Isn't it? This symptom also is asked. Another one medicine having this symptom is calicut. Okay. Amyl nitrosum, this flushing and blushing is a very important symptom. As I told you, menopausal, so there will be flushing. Another one symptom is blushing. So flushing and blushing are important symptoms of amyl nitrosum. Fine. Retained placenta from atony of uterus, Sabina. What is the complementary medicine of Sabina?
Thuja.
Thuja. Complementary is Thuja. Sabina has also got figworts with intolerable itching and burning. Exuberant granulations. Okay. Acha. Sabina, this also has the power to expel moles or foreign bodies from uterus like cantheris. So Sabina, another one is cantheris. Okay. Shivers in first stage of labor, it is Actia resmosa. There will be convulsions during the first stage, Actia resmosa. Spasmodic rigid os, polyphylum. Acha, now tell me, pruritus vagina during pregnancy. It is so much that it induces onanism. What is the medicine?
Platina.
Huh?
Platina.
Caladium.
Caladium. No, not platinum. Caladium. To correct deranged vitality and produce efficient pains when no progress is made. Colophylum. And when given in the last month of pregnancy, it shortens labor. Actia resmosa. Okay. Now tell me, when there is uterine hemorrhage before puberty, very important, very frequently asked. Uterine hemorrhage before puberty. Okay. Hint. Very good medicine which we give for worms, especially in children. Now tell me. Not enough hint? What medicine do you give for worms? The easiest one is the answer. Worm affections, what medicine do we give? Shubhangi?
Thuja causticum.
Huh?
Thuja causticum.
Worms? Worms. WORMS, worms. Not warts.
Sinner.
Sina. Sina is the medicine for uterine hemorrhage before puberty. Acha. Important symptom is abnormal consciousness, as if having committed some evil deed. Okay. Peculiar symptom of Sina. Sina has another important stool, popcorn stool, white mucus like small pieces of popcorn. So popcorn stool is Sina. Okay. Before we go to leukorrhea, bilious complication during gestation. Think of the easiest drug. What comes into your mind when you see bilious? Bilious, jaundice, what comes into your mind?
Chelidon.
Chelidonium. Okay. Achha. When the leukorrhea is acrid, running down to the hills, medicine is alumina. Alumina has got a very peculiar abdominal symptom. What is that? Remember? No? Left-sided abdominal complaints. Left-sided abdominal complaints, call for it. Very important one. It has come in some year PSCs, some year AIPGTs. Very important question. Okay. Another one important mental symptom of alumina is suicidal tendency on seeing knife or blood. Suicidal tendency on seeing knife or blood. Okay. Next, thick bluish white mucus. I think this is the only drug which is having bluish leukorrhea. Medicine is ambrosia. Okay. Here I said that we have left-sided abdominal complaints. Ambrosia has one-sided complaints. One-sided complaints call for it. Okay. Acha. Bluish leukorrhea, you have ambrosia. When you have bluish white coating on tongue, bluish white coating on tongue. Acha, not a very common drug. So I won't wait, or I can't give any hint also. Okay. See, it is gymnocladus. Bluish white coating on tongue, it is gymnocladus. Fine. In ambrosia, you have discharge of blood between periods at every little accident. Sorry, not during, between periods. Between periods at every little accident. Passing imperceptibly from the very relaxed parts. It is agnus castus. Here in agnus castus, the characteristic of leukorrhea is that it is transparent, but it stains the linen yellow. Transparent, but stains the linen yellow. As if warm water were flowing. Borax. Aggravated before menses. Leukorrhea aggravated before menses, it is sepia. Ameliorated after menses. Creosote, borax and bovista. All except question can come, mark it. And aggravate 10 days after menses. Conium, borax and bovista. A few more points we'll discuss, then we'll stop.
We aggravate 10 days after menses में कोनियम बोरेक्स और वो हो गया.
Pain in uterus and right ovary. And a very peculiar symptom with shifting noises along ascending colon. Shifting noises along ascending colon. Tell me. Okay, very good medicine for diarrhea. Diarrhea is generally found in the morning, stops within afternoon. Now tell.
Podophylla.
Very good. Okay. Now, what's around external os? Very easy. What's around external os? This is very easy. Tell. Shumangi?
Cantharus.
Huh? No, no. Not Cantharis. Calendula. Frequently asked question. Very important. Acha. Calendula has got a peculiar deafness. What is that? Think. Deafness of calendula is asked. Deafness which is worse in damp surroundings. And it is associated with eczematous conditions. Eczematous conditions. Hears best in a train and distant sounds. Very important point. Very peculiar, very important. Hears best on a train and on distant sounds and distant sounds. Okay. Achha. What's around external loss? This we got. Now, if I ask erosions around external loss, what will be your answer? Think. It is uncommon medicine. Vespa crabro. Okay. Achha. Here we have discussed that here's best on a train is calendula. Now, if I give you another, if I tell you to guess another medicine which is also having hardness of hearing, which is ameliorated by riding in carriage or train, what will be your answer?
Rhino.
No.
Riding.
Carriage. एलन का लाइन है बोलो. Okay. A very keynote hint.
Nitric acid.
Very good. Splinter like pens. Nitric acid. और एक ड्रग भी है, that is graphitis.
Graphitis.
Okay. Now, carriage related another one question. I think someone asked this in group few days back. Note it. Fears riding in a closed carriage. Why? Because she feels she could jump out. Of being obliged to jump out. Bolo. Of being obliged to jump out. What is the medicine?
Cancerous.
कैंथर से ऑब्सेशन हो गया क्या? No, it is not cancer. It is simsifiga. I think you people are having confusion with cantharis and simsifiga. No. Line of boarding, very important line. This is, I think, also in your success MCQs, as far as I think. Okay. Very important point. Achha. Another one. Waving sensation or sensation of opening and shutting in the brain. Please don't say cantharis.
Cannabis.
Achha. Another one.
Actia.
Active. Very good. Cannabis what?
Indica.
Cannabis indica. This is simsifiga or actia resmosa, whatever. Cannabis, generally the word calvarium is found in cannabis. Okay. Sensation, I'm writing it over here. I'm continuing it over here. Sensation as if the calvarium was opening and shutting. If both options are given, choose cannabis. If only actia is given, choose actia. But this actia is important. Okay. Apart from actia, actia is there. Apart from actia, cannabis sativa. Sorry, cannabis indica. Okay. So this is all for today. Any queries? Any questions? No? Then go through your questions. Thank you, everyone. Good night.